I'm Dr. Fakir Raveri, and this is Clinical Microlearning. Here's a self-assessment question. A 25-year-old male presents to the ER with a high fever and altered mental status. A lumbar puncture is performed and the CSF reveals the presence of bacteria. Which site is considered sterile and bacterial presence indicates an infection? A. Intestines, B. Skin, C. Mouth, D. Cerebrospinal fluid, or E. Nasopharynx. Please pause this video and think about the correct answer. The correct answer is D. Cerebrospinal fluid, or CSF. Now here are the sterile sites in the body that are sterile in most healthy humans. So all internal organs are supposed to be sterile. Blood is supposed to be sterile, so the presence of bacteria will indicate an infection. CSF in the brain essentially should be sterile. Presence of bacteria will indicate infection. The liver, spleen, kidney, and lower bronchi and alveoli in the lung are also considered sterile. And sometimes bladder, especially in young men, is considered sterile. In a lot of individuals, bladder can actually be colonized by bacteria, but not necessarily be infected. Here's the next self-assessment question. A dental patient undergoing a tooth extraction experiences bacteremia post-procedure. Which bacterium commonly found in the oral cavity is known to occasionally cause endocarditis following dental procedures? A. Viridans streptococci, B. Staphylococcus epidermidis, C. Klebsiella, D. Bacteroides, or E. Listeria. Please pause this video and think about the correct answer. The correct answer is A. Viridans streptococci. So bacteria that belong to the oral cavity, so the normal flora inside the mouth, include Viridans streptococci, Peptostreptococcus, and Fusobacterium. So, Staphylococcus epidermidis is found on the skin but not in the mouth. Gram-negatives like Klebsiella are not found in the mouth, although they can be found in lower GI tract. Especially Bacteroides is really not found in the mouth. It belongs to the colon, so lower parts of the GI tract. And Listeria is not found in the oral cavity. It belongs to, for example, vaginal tissue. Here's another self-assessment question. Which bacterium is a common resident of the intestines but is not typically found as part of the skin's normal flora? A. Staphylococcus aureus, B. Viridans streptococci, C. Bacteroides, D. Streptococcus pyogenes, or E. Staphylococcus epidermidis. Please pause this video and think about the correct answer. The correct answer is C. Bacteroides. Essentially, on the skin, we can find Staphylococcus aureus, Staphylococcus epidermidis, and Streptococcus pyogenes, but not inside the intestines as part of the gut flora, whereas Bacteroides is specifically found as part of the gut flora. Now, Viridans streptococci are neither a common resident of the skin or the GI tract. So we can see here that on the skin, Staphylococci, as well as Streptococcus pyogenes. So this is group A strep. And then in the GI tract, we have mostly gram-negative rods like E. coli, Klebsiella, as well as Enterococcus faecalis, which is a gram-positive. But more importantly, we have gram-negative anaerobes like Bacteroides that are unique to the gut flora. If you like this micro moment, make sure to subscribe and like this video.